Hi, my name's Dr. Pavan and I'm a registrar in obstetrics and gynaecology, and I've been asked by Nessa Organics to speak to you today about the cervical screening programme. So the cervical screening test, or the smear test, is a test that's done not to look specifically for cancer of the cervix, but it's a test that's done to look for a high-risk HPV virus, that's human papillomavirus, and abnormal changes to the cells of the cervix, which could develop into cancer if it's left untreated over a long period of time. So that's why it's really important to engage with the screening programme. The test involves putting a speculum, which is usually a plastic but sometimes a metal cylinder, into the vagina, and then gently opening it so we can see the cervix, which is the neck of the womb, and then a small soft brush is used to take a sample of the cells from the cervix, and then those are sent to the lab to look at under a microscope and to look specifically for the HPV virus initially. The test isn't painful for most women, but some women do find it uncomfortable. If you are particularly anxious about having the test done, that's completely understandable, but it is really important that you let your nurse or doctor know so that they can support you through the process and make it as comfortable as possible. There are many women who are really worried about having the test done. That may be because they're worried about it being uncomfortable or that it might hurt. They might be worried about the process of having the speculum done because it's an intimate examination. They might be worried about how they look and whether their vulva looks normal compared to other people, and we completely appreciate this. But what I would say is that everyone is different. When we do these tests and these examinations, we don't judge anybody. It's just really important that we do the test in a way that's supportive and to make you feel as comfortable as possible. So please do communicate with us and let us know if there's anything that we can do to make the process better for you. You can also ask for a smaller speculum, so they come in different sizes, and we usually decide which size to use depending upon how many vaginal deliveries you've had in the past. But if you are nervous, please do ask for a small speculum, and I'm sure that can be accommodated. It may also help for you to insert the speculum in yourself because you'll know what to expect and when to expect it, so that may also help you. But there are also lots of other tips on Joe's Cervical Cancer Trust, as mentioned already. There's also lots of really helpful tips on Joe's Cervical Cancer Trust on website, so I would encourage you to have a look there. But some of these things that can make the test easier for you include taking someone with you. So that's more difficult now because of COVID-19, but you can still have someone with you on the journey to where you're having the test done or back, so that you can speak to them about how you feel, and it might make you feel less anxious about having the test done. 24 hours before having your smear test, you should avoid using spermicides or any oil-based lubricants. And also, if you are on your period or if you are due your period for when your smear test is booked, then it's best to rebook for an alternative time because it can make it more difficult to get a result if the smear test is taken whilst you're menstruating. There's no particular single thing that can be done to prevent cervical cancer, but there are things that can be done to reduce our risk of developing it. So firstly, as already mentioned, engaging with the cervical screening programme is probably one of the most important steps because it will allow us to pick up the HPV virus and any abnormal changes to cells early before they develop into cancer. Also, in England, we offer the HPV vaccination to children in year 8 at school, so they're usually around 12 to 13 years old, and it involves 2 vaccinations 6 months apart. And again, this can reduce the risk of developing the HPV virus, but it doesn't eliminate the risk altogether. It's also important to practice safe sex, so using condoms can again reduce the risk of passing the HPV virus on. It can be passed on by any skin-to-skin contact of the genital area. Also, if you can avoid smoking or stop smoking, then this is also a good step to take because we know that women who smoke find it more difficult to get rid of the virus once they do have it and to clear it away. If you receive a invite for your smear test whilst you're pregnant, then you should let your nurse or doctor know that you are pregnant so that this can be rearranged for 3 months after you've had your baby. If you don't get an invite back 3 months after you've had your baby, then please do chase that up so you're not missed and that you do get the smear test that you need. If you are under follow-up for abnormal smears and find out that you're pregnant, then it's still really important that you do attend any appointments that you have. Let them know that you're pregnant, and then an appropriate management plan can be put together for you. If you're under colposcopy follow-up, again, it is important that you attend. Let them know that you're pregnant. And usually having a colposcopy itself, which is taking a closer look at the cervix, is safe. But any treatment or any biopsies may be delayed whilst you're pregnant. So thank you for watching. I hope you found that information useful. If you do have any further questions, then please do visit the NHS website or take a look at Joe's Cervical Cancer Trust for more information.